Dear students, welcome back. In this session, we are going to discuss about popliteus muscle. Normally, this popliteus muscle is related to the floor of the popliteal fossa. This muscle also forms the floor of the popliteus fossa. If you see the shape of this muscle, which is a flat triangular muscle. So, the popliteus muscle is a flat triangular muscle forming the floor of the 1/3 of the popliteal fossa. So this is the flat triangular muscle, that is popliteus. Okay, now we will see the origin of this popliteus muscle. The origin is inside the capsule of the knee joint. So this is the capsule of the knee joint. So normally the capsule of the knee joint is actually very complex thing that we are going to discuss in the knee joint. Okay, and the origin is inside the capsule of the knee joint but is extrasynovial. So here the very important thing about the origin is it is originating inside the capsule of the knee joint, but it is extrasynovial. So what do you mean by intrasynovial and extrasynovial? We are going to discuss in the knee joint. Okay. Yes. Larger lateral part of the muscle arises by a tendon from the anterior part of the popliteal groove. Okay, on the lateral surface of the lateral femoral condyle. Okay, and the smaller medial part arises from the arcuate ligament. So the smaller medial part arises from the arcuate ligament of the knee joint. Some fibers also arise from the outer margin of the lateral meniscus. Outer margin of the lateral meniscus. Okay, so and also sometimes an additional head arise from the sesamoid bone in the medial head of the gastrocnemius. So these are all the origin for this popliteus muscle. Okay, it is actually the muscle is having larger lateral part and smaller medial part, and larger lateral part arises by a tendon from the anterior part of the popliteal groove on the lateral surface of the lateral femoral condyle, and the smaller medial part arises from the arcuate ligament of the knee joint. Some fibers arises from the outer margin of the lateral meniscus. Okay, and an additional head may sometimes arise from the sesamoid bone in the medial head of the gastrocnemius. Okay, if you see the insertion of this muscle, so the tendon comes out of the capsule, okay, knee joint, through an opening on the posterolateral part of the capsule. Through an opening on the posterolateral part of the capsule. The muscle is inserted into the medial 2/3 of the triangular area above the soleal line on the posterior surface of the tibia. So we have studied about the soleal line in the osteology of the tibia, which is present on the posterior aspect. Okay, the muscle is inserted into the medial 2/3 of the triangular area of the soleal line on the posterior surface of the tibia, and also into the tendinous expansion covering the muscle. So this is the insertion of the popliteus muscle, and nerve supply is by the tibial nerve. So what is the nerve supply? So popliteus muscle is supplied by the tibial nerve. So that is the medial component of the sciatic nerve. Okay, so this is the sciatic nerve, which is divided into tibial and common peroneal. So this popliteus muscle is supplied by the tibial nerve. If you see the action, so it is the key muscle which unlocks the knee. It is the key muscle which unlocks the knee at the beginning of flexion of the fully extended knee by producing medial rotation. So by producing medial rotation of the tibia. Okay, or we can call it as medial rotation of the leg or lateral rotation of the thigh. Okay, so this is the action, and it draws the posterior position of the lateral meniscus backwards. So here actually the meniscus is present between this thing. One is the medial meniscus and lateral meniscus. It draws the posterior portion of the lateral meniscus. This is the lateral meniscus. During the lateral rotation of the thigh, and flexion of knee, and thus protects the meniscus from getting crushed between the femur and tibia. So these are the main functions about the popliteus. Thank you.